Okay, so Christopher, he is going to be my patient and he's all gowned up. So I'm going to go through the abdominal exam. I'm going to ask you to roll this up, please. So we're going to roll this up about nipple line for Christopher. There we go, good. And we're going to just start with general inspection. I'm going to have you move your hands so I can see more of your abdominal. There you go. You can rest them comfortably by your side if you would like. And I'll be checking for any masses, any unusual skin or hair patterns or anything like that, moles, abnormal scars, any lumps. If I see a lump, I can use my pen light and cast an oblique shadow across that to identify that more closely. So we do that. I see that everything's okay. I would have his, as you can see, his pants are down to his pubic bone like such. And then we're going to auscultate with the diaphragm in the different quadrants for 5 seconds in each. So I would begin in the lower right quadrants for 5 seconds, then upper right, then upper left, then lower left, each of those for 5 seconds. And then I would use my bell, so flip it over to the bell, and I'm going to listen to each of the arteries. So our renal arteries on each side, iliac arteries on each side, our femoral arteries on each side, and then our aorta right off the umbilicus slightly, making sure there's no sign of bruise there. Then I'm going to listen for a pleural rub up on the liver. You're good there, and over on the spleen as well. Very good. Then we're going to go to some general percussion. So we'll percuss down 3 lines, just listening for anything unusual there. I'm going to percuss the liver, so I'll still start lower nipple line until I find that, and then I can instruct the patient to place 1 finger where it begins, and then starting lower umbilicus up until I find the lower aorta, and measure that to make sure that is a proper width. And then I can also do that on the spleen as well, over here on the side, and percuss that as well, making sure that's good. You can put your hand down, Mr. Jones. And then I will palpate. So we can begin by palpating, just following, starting lower right quadrant, just nice, light and superficial across. Good. And then we'll go a little bit deeper the second time around, seeing if we feel anything unusual or if there's any pain with this. Let me know if there's any pain, Mr. Jones. And then we can palpate for the lower border of the liver. So I'm going to instruct the patient to breathe in and then out, and I'm going to ride that down and try to feel that lower border of the liver right there. I can as well find the spleen, and I'm going to sandwich the spleen on this side. And I can instruct the patient to breathe in and out and do that as well as the kidney on both sides. So getting our hands under here and then squishing that down. I would do that on each side as well. Then we're going to go to McBurney's point. I'm going to just push down and rebound. So if there's any pain with that. Also on the opposite side to see if we can have any localized pain that would indicate appendicitis. We can also palpate the abdominal aorta pulse. There we go, good. And then we're going to do to the obturator, do some internal and external rotation. I'm also going to have the patient either lie on his side to check the psoas, or we can check the psoas actively by having the patient resist me. There you go, good. You can relax, and we would do that on both sides. One thing I did forget was to put a roll under Mr. Jones's knees, so I'd remember to do that. And that's it.